You could be eating every day, taking your vitamins, following doctor's orders, and still slowly starving your body of the nutrients it desperately needs. After 60, your body changes in ways most people never learn about. Your stomach produces less acid, your kidneys work differently, and even your taste buds betray you. The scary truth? Nearly 80% of seniors over 65 have at least 3 silent nutrient deficiencies they don't even know about, quietly setting the stage for memory loss, muscle weakness, heart problems, and infections that could have been prevented. These aren't the obvious deficiencies doctors test for. These are the hidden ones lurking beneath normal blood work, slowly chipping away at your strength, your mind, and your independence. In this video, we're exposing the 6 most dangerous silent nutrient deficiencies after 60, ranked from common to absolutely critical. We'll reveal the warning signs most doctors miss, the surprising foods that can fix these problems fast, and the one deficiency at the end that affects 95% of seniors, but almost no one talks about. Stick around until the end, because the number 1 silent deficiency has been linked to a 340% increase in infection risk and can literally steal your memory in just months. But when caught early and fixed properly, people see improvements in energy and mental clarity in as little as 2 weeks. But before we begin, quick question. Have you noticed any changes in your energy, memory, or strength since turning 60? Drop your age and what you've noticed in the comments. We read and reply to every single one. Now, let's start with deficiency number 6, a mineral so important that when you're low on it, your entire immune system starts to fail. Number 6. Zinc, the silent immune system destroyer. Zinc deficiency might be the most overlooked health crisis among seniors today. This essential mineral is involved in over 300 enzymatic reactions in your body. Yet research shows that up to 45% of adults over 60 are deficient, and most have no idea. Here's what makes zinc deficiency so dangerous after 60. Your body's ability to absorb zinc drops dramatically with age. Your stomach produces less acid, which is essential for zinc absorption. Many common medications, including antacids, diuretics, and even antibiotics, can block zinc uptake. And unlike other nutrients, your body has no way to store zinc, so you need it every single day. The consequences are severe. A 2024 study published in Immunity and Aging found that seniors with zinc deficiency had remarkably similar immune system changes to what we see in normal aging, including reduced thymus activity, impaired T-cell function, decreased response to vaccinations, and chronic low-grade inflammation. This means that zinc deficiency literally accelerates the aging process. But here's what's truly frightening. Research from nursing homes found that the seniors with the lowest zinc levels were those who were bedridden, had the lowest body mass index, and showed the most severe cognitive decline. Zinc deficiency wasn't just making them sick, it was stealing their independence. The warning signs are subtle at first. You might notice small cuts taking longer to heal, getting more colds than usual, or losing your sense of taste and smell. Your hair might become thinner, your nails might develop white spots, and you might feel mentally foggy without knowing why. A recent study with 97 healthy elderly from Italy, Greece, and Poland found that zinc supplementation produced measurable improvements in cognitive performance and mood within just 12 weeks. The participants scored better on memory tests and reported feeling less stressed and depressed. To restore zinc levels naturally, focus on oysters, which contain more zinc per serving than any other food. If oysters aren't your thing, beef and dark poultry meat are excellent sources. For plant-based options, pumpkin seeds, cashews, and chickpeas provide good amounts, though they're not as easily absorbed as animal sources. The key is consistency. Your body can't store zinc, so you need it daily. And here's a critical tip. Take zinc on an empty stomach if possible, but if it causes nausea, take it with food. Just avoid taking it with calcium or iron supplements, as they can interfere with absorption. If you've been getting more infections, feeling mentally cloudy, or noticing that cuts heal slowly, Zinc deficiency could be the hidden culprit robbing your immune system of its power. Number 5. Magnesium, the invisible heart and brain protector. Magnesium deficiency is one of the most underdiagnosed problems in seniors, yet it affects nearly every system in your body. A major European study found that 52% of adults over 60 had suboptimal magnesium levels, with the highest deficiency rates among those who were frail, physically inactive, or taking multiple medications. What makes this particularly dangerous is that magnesium deficiency is almost impossible to detect through standard blood tests. Only about 1% of your body's magnesium is in your blood. The rest is stored in your bones and inside your cells, so you can have normal blood magnesium levels while your tissues are severely depleted. After 60, several factors conspire against your magnesium levels. Your kidneys begin to excrete more magnesium. Your intestines absorb less. Many seniors eat diets low in magnesium-rich foods, and common medications like proton pump inhibitors, diuretics, and diabetes medications can deplete your stores even further. The consequences are far-reaching. Studies show that magnesium deficiency contributes to cardiovascular disease, type 2 diabetes, depression, Alzheimer's disease, muscle pain, chronic fatigue, and bone fragility. It's literally connected to almost every major health concern seniors face. The warning signs are often mistaken for normal aging: muscle cramps or twitches, especially at night, feeling tired despite getting enough sleep, irregular heartbeats or palpitations, mood changes, anxiety or irritability, trouble sleeping or restless legs, high blood pressure that doesn't respond well to medication. A 2024 study published in Nutrients showed that magnesium deficiency is linked to every hallmark of aging, including DNA damage, cellular inflammation, and mitochondrial dysfunction. When researchers corrected magnesium deficiency in older adults, they saw improvements in energy, mood, and even cognitive function. Perhaps most importantly, a large study following over 81,000 women found that those with higher magnesium intake had significantly lower rates of frailty, that dangerous combination of weakness, fatigue, and loss of independence that affects so many seniors. To restore magnesium levels, focus on dark leafy greens like spinach and Swiss chard, nuts and seeds, particularly pumpkin seeds and almonds, dark chocolate with at least 70% cocoa, and whole grains like brown rice and quinoa. Epsom salt baths can also help, as magnesium can be absorbed through the skin. If you're experiencing muscle cramps, sleep problems, or feeling more anxious or irritable than usual, magnesium deficiency could be the silent factor affecting your heart, your brain, and your overall quality of life. Number 4. Vitamin D, the stealth bone and brain destroyer. Vitamin D deficiency is reaching epidemic proportions among seniors, yet it's one of the most preventable health crises we face. Recent population studies show that 52% of community-dwelling seniors have vitamin D levels below the minimum threshold for health. But here's what most people don't understand. Vitamin D isn't just about bone health. Vitamin D deficiency has been linked to increased risk of falls, type 1 diabetes, cardiovascular disease, rheumatoid arthritis, and even certain cancers. Your immune system depends on vitamin D to function properly, which is why deficient seniors get more infections and have worse outcomes when they do get sick. The problem after 60 is multifaceted. Your skin becomes less efficient at producing vitamin D from sunlight. You likely spend more time indoors. Your kidneys become less effective at converting vitamin D to its active form, and you may avoid dairy products due to lactose intolerance. The silent symptoms sneak up slowly. You might feel more tired than usual, experience muscle weakness or aches, notice mood changes or depression, or find that you're getting sick more often. Your bones might ache, especially in your back, or you might have trouble sleeping. The long-term consequences are severe: increased risk of diabetes, heart disease, immune system disorders, certain cancers, and multiple sclerosis. And for seniors, The most immediate danger is falls and fractures. But here's the encouraging news. Vitamin D deficiency is one of the easiest to fix. The best source is still sunlight. Just 10 to 15 minutes of unprotected sun exposure on your face and arms, 2 to 3 times per week. Your body can't make vitamin D through glass windows or with sunscreen on, so those few minutes of direct exposure are crucial. For food sources, focus on fatty fish like salmon, mackerel, and sardines. Egg yolks from pasture-raised hens contain good amounts. Many foods are now fortified with vitamin D, including milk, cereals, and orange juice. If you're experiencing unexplained fatigue, muscle aches, or getting sick more often, vitamin D deficiency could be the hidden factor weakening your bones, your immune system, and your overall vitality. But before we continue, if you're finding this information helpful, hit the like button and subscribe with notifications on. Your health is too important to leave to chance, and we're just getting started with the most critical deficiencies. Number 3. Folate, the hidden memory and heart protector. Folate deficiency is one of the most overlooked threats to brain health in seniors, yet it's easily preventable when you know what to look for. Studies show that 8.7% of seniors have low folate levels, but the real concern is that even borderline low levels can have serious consequences for your mind and heart. Folate is crucial for the production and formation of red blood cells and for healthy cell growth, function, and regulation. But what many people don't realize is that folate deficiency can mimic the symptoms of dementia and depression, leading to misdiagnosis and unnecessary suffering. After 60, several factors increase your risk of folate deficiency. Certain medications, including metformin for diabetes, phenytoin for seizures, and even some antacids can interfere with folate absorption. Alcohol consumption depletes folate stores, and many seniors simply don't eat enough folate-rich foods. The neurological symptoms can be devastating. Folate deficiency can cause macrocytic anemia, but more concerning are the brain changes, memory loss, confusion, depression, and difficulty concentrating. Some seniors are mistakenly diagnosed with dementia when their real problem is folate deficiency. Low serum folate levels have been associated with atrophy of the cerebral cortex, actual brain shrinkage that was thought to be caused by elevated homocysteine levels, which folate helps regulate. The warning signs are often subtle. You might feel more forgetful or have trouble concentrating. Mood changes, including depression or irritability. Fatigue that doesn't improve with rest. Pale skin or a swollen red tongue. Digestive problems or loss of appetite. But here's the good news. Since breakfast cereals have been fortified with folate, deficiencies have become less common. However, if you don't eat fortified cereals or plenty of fruits and vegetables, you may still be at risk. To restore folate levels naturally, focus on dark leafy greens like spinach, kale, and romaine lettuce. Legumes including lentils, chickpeas, and black beans are excellent sources. Asparagus, broccoli, and Brussels sprouts provide good amounts. Citrus fruits and fortified whole grains can also help. The key is eating these foods regularly, as folate is water-soluble and doesn't stay in your system long. And be careful with cooking. Folate can be destroyed by heat, so lightly steamed or raw vegetables are best. If you've been feeling more forgetful, depressed, or tired lately, folate deficiency could be the hidden factor affecting your brain health and stealing your mental sharpness. Number 2. Iron, the silent energy and cognitive thief. Iron deficiency in seniors is a silent epidemic that's often overlooked because the symptoms develop so gradually. Studies show that 11% of community-dwelling seniors have insufficient iron levels, but this number jumps much higher among those who are frail or have chronic health conditions. What makes iron deficiency particularly dangerous after 60 is that it doesn't just cause anemia, it directly affects your brain function, heart health, and immune system. Iron deficiency can cause cognitive impairment, increased susceptibility to infections, and poor wound healing. all critical issues for seniors. The problem is that iron deficiency in older adults often has different causes than in younger people. It's rarely just about diet. Common causes include internal bleeding from ulcers or medications, malabsorption disorders, kidney disease, or chronic inflammation that prevents iron from being properly utilized. The symptoms creep up slowly. You might feel tired all the time, even after sleeping well. You may feel cold frequently, especially in your hands and feet. Headaches and dizziness become more common. Some people develop unusual cravings for ice, starch, or other non-food items. But here's what's truly concerning. Iron deficiency can cause hair loss, brittle nails that may become spoon-shaped, and pale skin. More seriously, it can affect your heart, causing irregular heartbeats as your heart works harder to pump oxygen through your body. The cognitive effects are particularly troubling. Iron is essential for healthy brain function, and deficiency can cause problems with concentration, memory, and overall mental clarity. To restore iron levels safely, focus on heme iron from animal sources, which is more easily absorbed. Lean red meat, poultry, and fish are excellent choices. For plant-based iron, combine iron-rich foods like spinach, lentils, and fortified cereals with vitamin C-rich foods like citrus fruits or bell peppers to improve absorption. But here's a critical warning. Don't start taking iron supplements without consulting your doctor first. Too much iron can be dangerous, especially for seniors, and iron deficiency in older adults often indicates an underlying medical condition that needs to be diagnosed. If you're experiencing persistent fatigue, feeling cold all the time, or noticing changes in your hair or nails, iron deficiency could be the hidden factor draining your energy and affecting your cognitive function. Number 1. Vitamin B12, the ultimate silent brain and nerve destroyer. Vitamin B12 deficiency is the most dangerous silent nutrient deficiency affecting seniors, yet it's also the most preventable when caught early. Here's the shocking truth. 27.3% of seniors have low vitamin B12 levels, and up to 25% of institutionalized elderly are deficient. Even more concerning, research estimates that up to 15% of older adults are severely deficient, with another 20% at risk. What makes B12 deficiency so dangerous is that it can cause permanent nerve damage if left untreated. B12 deficiency can cause macrocytic anemia, subacute combined degeneration of the spinal cord, neuropathies, ataxia, glossitis, and dementia. The neurological damage can be irreversible if the deficiency persists for too long. The problem after 60 is primarily absorption. As you age, your stomach produces less acid, which is necessary for B12 absorption. Many seniors also develop atrophic gastritis or pernicious anemia, conditions that make B12 absorption nearly impossible. The most common causes in elderly include decreased gastric acid production, which occurs in up to 15% of seniors older than 65, and Helicobacter pylori infection of the stomach. The symptoms are often mistaken for normal aging, which is why this deficiency is so dangerous. Early signs include fatigue, pale skin, loss of appetite, and numbness or tingling in hands and feet. As the deficiency progresses, you might experience balance problems, difficulty walking, memory loss, confusion, and even symptoms that look exactly like dementia or Alzheimer's disease. The neuropsychiatric symptoms can include delirium with slowed thinking, confusion, memory loss, and depression, symptoms that are difficult to differentiate from Alzheimer's disease. Some seniors are institutionalized for dementia when their real problem is B12 deficiency that could be easily treated. Here's what makes this deficiency particularly insidious. It can take up to 3 years to develop B12 deficiency severe enough to cause symptoms, because your liver stores several years' worth of B12. But once those stores are depleted, the damage can happen quickly. B12 is crucial for creating red blood cells and DNA, and for maintaining healthy nerve function. Without enough B12, your body can't make healthy red blood cells, and your nervous system begins to deteriorate. The most reliable sources of B12 are animal products: meat, fish, poultry, eggs, and dairy products. Plant-based eaters need to be especially careful, as B12 is not naturally found in plant foods. Fortified nutritional yeast, plant milks, and B12 supplements become essential. But here's the critical point. If you're over 60, you likely need B12 supplements regardless of your diet. The body's ability to absorb B12 can decrease significantly with age, and certain medications can also lower absorption. This is one supplement that most seniors should discuss with their doctor. For those with absorption problems, sublingual B12 tablets or B12 injections may be necessary. The good news is that B12 supplementation can reverse many of the symptoms, but only if the deficiency is caught before permanent nerve damage occurs. If you've been experiencing memory problems, balance issues, numbness in your hands or feet, or persistent fatigue that doesn't improve with rest, B12 deficiency could be the hidden factor quietly damaging your nervous system and stealing your cognitive function. There you have it. 6 silent nutrient deficiencies that could be quietly undermining your health, your energy, and your independence after 60. The scary truth is that these deficiencies often work together, creating a downward spiral of declining health that's mistaken for normal aging. But here's the empowering reality. Every single one of these deficiencies is preventable and treatable when caught early. Your body has an incredible capacity to heal and restore itself when given the right nutrients. The key is awareness and action. Pay attention to the subtle signs your body is giving you. Don't dismiss fatigue, memory problems, or physical changes as just part of getting older. Many of these symptoms could be your body's way of telling you it needs specific nutrients to function properly. Work with healthcare providers who understand the unique nutritional needs of seniors. Ask for comprehensive testing that goes beyond basic blood work. And remember that prevention is always easier and more effective than trying to reverse damage after it's already occurred. Most importantly, focus on nutrient-dense whole foods rather than relying solely on supplements. Your body absorbs and utilizes nutrients from food more effectively than from pills, and whole foods provide the cofactors and synergistic compounds that make nutrients work optimally. Which of these deficiencies surprised you the most? Have you experienced any of these symptoms? Let us know in the comments. We read and reply to every single one. Your experience might help another senior recognize their own nutritional needs. And if you want more evidence-based health information specifically for seniors, make sure to subscribe and turn on notifications. Your health is your most valuable asset, and staying informed is the first step toward maintaining your vitality, independence, and quality of life for years to come. Remember, you're not just aging. You're potentially dealing with correctable nutritional deficiencies that have solutions. Take control of your health, advocate for proper testing, and give your body the nutrients it needs to thrive after 60. Thanks for watching, and here's to your continued health and vitality.